Good day to you. This is Norman Morris coming to you from Cornerstone Senior Services out of the Asheville, Western North Carolina area. I'm an insurance agent and I help people navigate through the Medicare Maze. So I'm creating a few videos to help people understand what Medicare is, the parts of Medicare, what they can do to make their Medicare better, and basically to get all the benefits they are entitled and that they deserve. So we've gone over what Medicare is and the parts of Medicare. One of the parts we need to talk about is Part D, which is the drug plan or prescription drug plan. And so why does someone need a prescription drug plan? I hear people all the time ask, I don't take any prescriptions, why do I need one? There's two reasons I tell people why they need a prescription drug plan. One, this is the one part that is usually the costliest or the most consistent cost in regards to your health insurance. And so you need to have that because it does help pay for the prescriptions. And then the second part is eventually people are going to take prescriptions, and if you don't have a prescription drug plan when you first qualify for Medicare and you get one later, there is a penalty, and it's a lifetime penalty. So the technical penalty is that it's 1% of the national average cost of the prescription drug plans throughout the nation, which is about $35. So 1% of that's 35 cents, but that's for every month you don't have one. And some people are kind of like, well, that's really not a whole lot, but if you don't have, if it's 35 cents, just to make it easy, and you don't have one for 2 years, okay, that's 35 cents times 12, which is $8.40. And that's every month you're paying for the rest of your life. So you're paying almost $100 a year extra for nothing, okay? So I tell people to avoid that, just get the prescription drug plan. The reality is if something were to happen and you don't have one and you need to take a prescription, it could be kind of costly if you don't have one. So the one thing people ask is, okay, so how do I decide which prescription drug plan I need? Now, to begin with, if you have a Medicare Advantage plan, usually you have a prescription drug plan with that, you don't need that. But if you have a Medicare supplement or you have just Medicare only and you need a prescription drug plan, it can be kind of confusing. In Western North Carolina, there are 28 different drug plans, and they range from $7.20 up to $120 per month. How do you know which one you need to take? Which one do you need? What's going to be most beneficial to you? So there are a few questions you need to ask yourself in regards to choosing the right drug plan. First question is, are all your prescriptions on the formulary? What that means is that will your plan cover all the prescriptions that you take? So for example, there are some insulins that some plans cover and some don't. You obviously don't want to have a plan that doesn't cover your insulin. Very important. All right. The second part is, what is the deductible? Some plans have a lower deductible than others. So what that means is you have to pay so much money out of pocket before your plan will kick in. So is that an important factor for you? Obviously, 3, the cost of the medications. Some plans it's going to be cheaper than others. Some offer home delivery. Some offer a 3-month bundle versus 1 month. It's cheaper to get 3 months versus 1. So that's something you need to consider as well. Fourth one is, does your pharmacy take it? So if you go to a local mom and pop pharmacy, will they take your prescription plan? If they don't, then you need to either choose a different plan or you need to find a different pharmacy. And I never tell people what they need to do. You need to do something that's comfortable for yourself, and that's something you need to ask yourself as well. And so when you are going over your prescription drug plan with an agent, and this is one thing I do every year, is I call my clients and I say, hey, are you happy with your prescription drug plan? I tell them if there's any changes, and if the cost is going up or down, then or if they're taking different prescriptions, then we need to look at that. And it's very easy. All you do is go into a website called Medicare.gov, put the prescriptions in, put your pharmacy in, and it will show you which plan is going to be most cost effective for you. So the other issue that comes up with prescription drug plans is what's called the donut hole. So if you take certain prescriptions that can be expensive, blood thinners are very expensive. Anything that's heart related, insulin was, but they've started coming up with programs that can help reduce the cost of that. Some major brand name medications, you're going to hit what's called the donut hole. Now, sounds pretty nice, right? It's donuts. Who doesn't like donuts? But the reality is, it's not a very pleasant thing. And what the donut hole is once your prescriptions, their cost, not what you pay, reach over $4,130, you can be responsible for up to 25% of the cost. So if you take a prescription, for example, Xarelto is a common one, and Xarelto costs about $600, you can be responsible for up to $150 per month for that prescription. All right. Now, once you spend a certain amount of money, it drops significantly, but you want to make sure that your plan helps cover your prescriptions, and you can look at a plan and you can see when you'll hit the donut hole. And I do this all the time. People will put their prescriptions in, and I'll say, hey, you're going to hit the donut hole in September, or you're going to hit it in November. I've had some people, they take a lot of prescriptions, some pretty powerful names, and they hit the donut hole within February or March. So, it can be pretty expensive pretty early in the year. Now, some people say, well, how do I get my prescriptions reduced if I take some pretty expensive prescriptions? Okay, one, you want to make sure you're on the right plan. Very important. Two, some manufacturing companies offer help with prescriptions. Three, look at outside resources. I have a client who went through something called the Eagle Pharmacy for a very powerful blood thinner and has cost reduced from $225 to $75. So, and that's for a 3-month supply. So look at outside resources. 4, talk to your doctors, see if there are samples. I used to have clients who, for the insulin, would have to check and see if their doctors had certain insulin or different medications to lower the blood sugar. And a lot of times they could get samples from their doctors. Another one, you see these ads all the time. Martin Sheen advertises Single Care, and GoodRx is another popular drug discount. And so you can actually use these drug discount cards with your insurance. I have one client, he or she took 19 medications. 18 of the 19 were covered by one plan, very affordable, but the one that he had wasn't covered. And so he had to pay more out of pocket for that, but he had a GoodRx card, and that GoodRx card covered the prescription. He paid very minimal amount for that. So you can use the two in combination. And the last one is you can qualify for what's called LIS, Low Income Subsidy Help. And what that is there's a program through Social Security that will actually help you pay for your prescriptions, and you can get that lower as well. And in fact, if you do qualify for that, when you go on Medicare.gov, I encourage everyone to sign up for a Medicare.gov website for an account there, because it will tell you what your costs of your prescriptions are, and it will save them year by year. So you can go through every year. If your prescriptions change, you can take the ones out, you can add new ones in, and it'll tell you what you'll be paying for your medications. So hopefully this has been helpful. If you have any questions, please give me a call. Appreciate your time, and thank you so much. Stay safe out there. Bye.